It was back in February when the Trump administration screwed up the development of an American test for COVID. That was sort of the original sin in terms of why we didn't have testing when the whole rest of the world did. That screw up was in February. By March, as case numbers were ticking up and it was starting to look very serious in some parts of the country, we were seeing the consequence of that testing failure by the Trump administration all over. This was a headline from back in mid-March in the Denver Post. Line cut off at Denver's drive-through coronavirus testing site after wait time hits 4 hours. This was a headline from New Mexico around the same time, again, back in March. Las Cruces, New Mexico. Long lines for coronavirus testing in Las Cruces. Supplies run out after just 2 hours. At the time, the New York, again, this is months ago, New York Times was running big national stories with headlines like this one. The Lost Month. How a failure to test blinded the U.S. to COVID-19. You see the date on that? That's from March. A lost month. That was the lamentation, right, back in March. Wow, we lost a month. We lost a whole month between February and March that we could have been testing for coronavirus. We could have been understanding our epidemic. We could have been working on it. We lost a month. It set us back a whole month. Well, now it's July. What's our testing situation like now? We lost a month. We had that time to catch up. Now it's July. Now we're halfway through the year. Now we've had multiple months to try to sort out those early problems. But this is still what the local news is like around the country right now.
The family clinic has been open for testing for about 3 months now, but in recent weeks, lines have snaked through the parking lot, people waiting for hours to get tested. Tell me, how long have you guys been out here?
Oh, we've been here since around 6:40.
Oh my God, yes. What time is it now?
So now it's 11:12. We've advanced a few feet, I want to say.
Giovanni Salazar and his family, one of many waiting in line to get tested at the MD Family Clinic.
We thought we were going to be for like 2 hours, 3, but we're heading towards like 5-6 hours now.
Thousands have rushed to Utah COVID testing centers in the recent weeks. Medical professionals saying that they are seeing a 50% increase in those who are wanting to be tested.
That's making for long lines at those drive-up testing sites.
We have higher demand because of prevalence in the community.
Now, according to health directors, this backlog is occurring statewide.
Some people are even being turned away due to the influx of those who want to be tested. But health officials emphasize, although not everybody needs it, those who've been in close contact with someone who has a confirmed case should consider testing. Dr. Roman Nation says the clinic is trying to prioritize those who had direct exposure to COVID-19.
The message we're trying to get out to folks is to prioritize essential workers and especially healthcare workers, because those are the ones we need on the front lines to be able to work.
The clinic had to create a waiting list due to the skyrocketing demand for testing. This week, it started off with 30 names. Now it's more than 200 patients long.
Well, at our mobile drive-through yesterday, we literally had the line fill before the official start time, which was 9 a.m.
It's deja vu, right? I mean, that's all local news coverage from now. Our testing was a disaster in March, right? That was supposed to be our lost month, with the Trump administration screwing it up in February. And as of March, it was still screwed up because we were a month behind because of what they'd done. That was March. Our testing was a disaster in March, and we thought we knew why. Why is our testing still a disaster in July? Why have we got people in hours-long lines and waiting lists with hundreds of people on them? Right? Why are we now having people wait 3, 4, 5, 6, 7 days for test results? Right? And those were local news clips that I just showed you from Dallas-Fort Worth, from Salt Lake City, Utah, from Panama City, Florida. But honestly, pick your poison. Pick anywhere. This is the local news tonight in Alabama. Long lines for testing in Alabama. This is the news in Texas. Officials in Texas's big cities say their public testing sites are being strained. Austin, Texas has begun to limit who can be tested. In Georgia sees testing systems strained with rise in COVID cases. Here's the Tennessean tonight. Long lines reported at coronavirus testing sites across mid-state. Here's the LA Times today. As of Wednesday, yesterday, there were no available appointments for coronavirus testing at LA County or LA City-run test sites. Here's the Washington Post today. As cases surge, long lines for testing sometimes stretch miles in the summer heat. Americans are trying to do the right thing. Americans are trying to get tested. because they want to do the responsible thing, because they want to keep themselves safe. They want to keep their family members safe. Americans are trying to do the right thing and being very freaking patient about it, I might add. It is not the American people who are failing here. It is the government that has failed to make testing available in any workable way, even after all this time. And so, okay, even if you forgive them their initial screw up, why months later are we still looking at the same Groundhog Day headlines about the inability of people to get tested? I mean, even the major lab companies are now reporting that they are not able to keep up. They are not able to increase testing. Wow, there's rising case numbers all over the country in most states right now. They're not prepared for that. They are not able to scale up. Why is that? Because even for the biggest lab companies in the country, which are the same giant lab companies that we had at the start of this mess, over these past few months, the government has done no work to make sure the big lab companies in this country would scale up, would develop capacity to handle what we would need. We just squandered that time. Testing didn't get any better.